Hi, my name is Russell Weisz. I am an orthopedic surgeon at South Palm Orthopedics in Delray Beach, Florida. Today I wanted to talk about hip fractures, which are a very common occurrence here in South Florida. Each year, over 300,000 patients in the United States sustain a hip fracture. They are generally the result of a ground level fall or a simple fall in the underlying diagnosis of osteoporosis. A hip fracture can have a significant mental, emotional, and physical impact on the patient and the patient's family after they have occurred. Prompt, urgent surgical attention is generally required in order to ensure a successful outcome. The standard of care for a hip fracture can be either to fix or replace them, depending on certain fracture characteristics or patient level of function. I have performed thousands of these surgeries, the majority of which can be done in a minimally invasive fashion. After surgery, we try as best as possible to mobilize the patients the same day. Good outcomes also require a multidisciplinary team to address home health, physical therapy, the treatment of osteoporosis, and the prevention of future falls in the overall treatment of these patients. If you have any questions or know of someone that might benefit from a consultation who has sustained a hip fracture, please reach out to me at South Palm Orthopedics. Thank you for listening and have a nice day.